in a moment, we're going to show you some positions that can help assist you with the latent phase of labour. We want to show you how important positions can be in labour because it changes the diameters of the pelvis and the openings of the pelvis to help the baby navigate its way through the pelvis. Now I just want you to do an exercise with us just to show you how important this can be. So this is your pelvis, this is the front of the pelvis, and this is the back of the pelvis. And your pelvis moves constantly through labour, as you can see. Now, what we used to teach was something called upright, forward, open, and all this meant was be upright, lean forward, and keep your legs open. But in the last decade or so, science has changed and things have changed and research has changed, and we now know that this actually isn't true. So during the latent phase of labour, it's really important to keep your legs open because this opens the top of the pelvis and baby can get into the pelvis in a better position. In the active phase of labour, it's better to have your knees together because this actually opens the outlet and this is the pushing phase. So we just want to do a quick exercise with you guys just so you can remember how important this is. So if you look at Teresa, she's going to put her hands under her bottom and she's going to feel these bony parts. So if you could all do that now, sit on your hands and try and feel the bony parts. You can feel them, I promise, no matter how cushioned your bottom is. Then, if you put your legs apart, you will feel that that space actually closes. And then if you put your knees together, you'll feel that that space opens. It's a really good thing to think about when you're in labour.
So in hospital we have lots of equipment that help you with the positions during labour. So on the birthing stool, it's important in the first stage of labour to keep your legs open so that the pelvis will open and we allow your baby's head to go through the first part of the birth canal. In the second stage of labour, so when you start pushing, then your knees you should close so that the second part, so the final part of the birth canal will open and will allow the baby's head to come out. Remember though, it's important for you to feel your instinct, to feel your body and do what your body is telling you, so that will help your body to get in the position to help you and the baby for labour and to help the baby to descend to the birth, through the birth canal. Another position that you can use is to go on all four, like that. Keep your legs open and just lean on the birthing ball, and you can rock your pelvis as well. In this position, your partner can come in and he can rub your back as well to help you with contractions.
So during the latent phase of labour, that's the time where your contractions are still quite irregular and not too strong. It's really important to try and get some rest, especially if you're labouring at night time. We recommend that you try and lay on your left side, and this allows maximum blood flow to your baby and to yourself. If you're resting in bed and then you feel a contraction come on, you can always move to accommodate the contraction. So a really good position to get into is all fours. And as we showed earlier, this helps open the top of the pelvis to allow your baby to move through. And instinctively, your body will want to do this anyway. So a really good comfort measure, as we've talked about in another video, is water. And this accommodates the comfort measure of water and a good position in labour. So your partner can always help you with this. And it's basically just leaning forward in the shower and using the head of the shower on your partner's back. And this can really help make her comfortable and help her relax, which in turn helps her contractions become stronger, which we want to birth your baby. In the active stage of labour, which is medically defined as 4 centimetres onwards with strong regular contractions. During this time, it's really good to try and stay off your back if you can. And this is because, as we said before, the pelvis is changing so your baby can navigate its way through the pelvis. So as you can see, Teresa here is in a really good position. Her knees are still open and she's allowing her pelvis to open at the back. And if you look here, at this point, the sacrum can pop up slightly to open what we call the outlet of the pelvis to allow your baby to come through. Your partner at this point can rub the top of your back because it can be a little bit uncomfortable for you. So that's a really good position to get into. If you're fully dilated, so that's 10 centimetres, at this point your baby is being pushed through. And at this point it's really good if your knees are together and you're still on all fours, because that allows the sacrum to tilt up and it also allows the outlet to be open. And this really adds some space for your baby to pass through. A position you might instinctively want to get into, especially if you're resting between contractions, is what we call left lateral. This can help your baby come through the birth canal because you're off your back, and also your partner can help support you and hold your leg for you. So another good position is what we call the Queen's position, and we use this when a client has an epidural. And this is to sit them upright to allow the baby to come down and to try and open the pelvis as well. We have something called a peanut ball. Unfortunately, we can't show you right now because one of our patients is using it. But a peanut ball looks like a gym ball, but in the shape of a peanut. And we place this under your thighs or in other positions, and it opens the pelvis so the baby can pass through a lot easier. So this is a really good position for the birthing person and their partner to get into. That means your partner can give you as much support as possible. Now, Teresa here is on what we call a birthing stool. A birthing stool is really good to use for what we call the active phase of labour, so that's when we talk about 4 centimetres dilated and onwards, and also for what we call the second stage of labour, the pushing phase. Teresa can keep her knees open or her knees closed depending on what her body's telling her to do, and it helps with gravity to come through. Teresa can always lean back on her partner as well and have that extra support from her partner. The partner can also, between contractions, rub the client's back to help make them more relaxed and feel loved and protected. So instinctively in labour, there comes a point where a woman normally wants to pull on something and bear down. You can also do this by squatting and pulling on something. And a lot of women like to use their partner's necks. This is instinctive because this is what we call the expulsion reflex, and the baby's head's coming through the pelvis and it moves the sacrum out the way. And instinctively, this is when a woman leans forward and bears down to help her baby pass through. But most importantly, we want you to follow your body. Your body will tell you what position to get into to allow your baby to pass through your pelvis.